What you need to know to be an exclusive pumping mom. Breastfeeding is when you feed your baby breast milk, usually directly from your breast. It has been linked to higher IQ scores in later childhood in some studies. While breastfeeding, the physical closeness, skin-to-skin contact, and eye contact all help your baby bond with you and feel secure. Now let's talk about exclusive breast pumping. Exclusive pumping means that you make the choice to give your baby only breast milk that you expressed or pump. This picture tells you the 11 of the biggest pumping mistakes. 1. Not pumping for long enough. 2. Missing pumping sessions. 3. Not keeping to a pumping schedule. 4. Choosing the wrong breast pump for you. 5. Using a suction that is too high. 6. Using the wrong pump flange size. 7. Not using a hands-free pumping bra. 8. Building a freezer stash. 9. Not prioritizing your mental health. 10. Getting dehydrated. And 11. Thinking you don't need your hands. After knowing the mistakes, let's move on to some tips and highlights to help you master exclusive breastfeeding. Stick with your breast pumping schedule or you may have low milk supply. The picture on the right is an example of scheduling and planning the amount of milk required for your baby from birth to 1 year and beyond. Rent a hospital grade or buy good quality breast pump. Using a bad quality breast pump may cause sore or cracked nipple. Pump the milk until it starts slowing down and your breasts feel well drained, or otherwise it may cause mastitis or the inflammation of the breast tissue that sometimes involve an infection. Pumping usually takes longer time than breastfeeding, and it also requires good equipment hygiene. The picture on the top right corner are the 5 steps to wash your breast pump parts safely. First, use a wash basin and do not wash them directly in the sink. Second, take breast pump parts apart before washing. Third, use a bottle brush only used for infant feeding items. Fourth, scrub in hot soapy water, then rinse. And the final step is to allow the pump parts to completely air dry. Improper stored breast milk may be contaminated and cause gastrointestinal tract infection in babies. Carefully clean, sanitize, and store your pump equipment and other feeding items will help you protect your baby from gastrointestinal tract infection and oral candidiasis. Using non-standard breast milk bottle should be avoided. When you wash those standard bottles in high temperature, chemical from those bottles may harm your baby. Bottle-feeding babies are more prone to cause bloating and discomfort, so feeding from the breast is still the preferred choice. Research has shown that babies who are breastfeeding have better emotional development than the bottle-feeding babies. Bottle-feeding babies could increase risk of choking compared to those who are breastfeeding and therefore increase the risk of lung infection or aspiration pneumonia in infants. Breastfeeding can decrease uterine bleeding and helps the uterus return to its normal size faster. Last but not least, breastfeeding can help you lose weight. So if you want to get in shape as soon as possible, breastfeeding is still your choice. We appreciate all pumping moms who have discipline, determination, and patience. We are sure it will lead to successful breastfeeding. Understanding risk of bottle feeding makes most moms decide to start and go on breastfeeding, which is actually the perfect way to feed your babies. Breastfeeding Clinic is willing to give you any advice that will help you master your breastfeeding skills.